You as a phlebotomist have to know be familiar at least with the process and what aliquoting is and so that, and not only what centrifugation is, but also the maintenance of the machines and so on. So what does it mean to centrifuge a blood specimen? What does it mean? All it means is to separate the blood components. So you have your red blood cells, white blood cell, your plasma or serum. So when you put a specimen on a machine, a centrifuge, what it does is it spins very, very fast, and it separates the red blood cells from the plasma or serum, depending on what kind of tube you're using. Remember that when you're going to use a machine, the centrifuge, you have to make sure that the machine is balanced because it spins so fast. And if it's off balance, what it's going to do is going to shake the specimens and it's going to hemolyze them. It's going to ruin them. And you don't want to do that. So the machines have to be well balanced. You have to put the same amount of tubes. So they have to be balanced. So you have the container fits 6 tubes. You have to put, one after the other, okay? Alternate, so you can fit 3 tubes. If you only have 2 tubes, but you need to fill another space, then you can get another tube with the same size. You fill it with water and you put it in there. The machine has to be checked every day. Quality controls on these machines have to be done every day. Maintenance, cleaning the machine with an approved disinfectant has to be done every single day. That may be part of your job as well. Aliquoting the specimens, or what it means is that you're getting samples from the blood specimen. After you've centrifuged the specimen and the red blood cells and the serum or plasma are separated, you're going to get samples from that specimen. Usually the top has to be removed. So that top has to be done, removal of the top usually done in a very closed area where there's shields, and you have to be wearing face shield and all the gear so that you don't get splashed with aerosols that may go into your eyes, which would not be good. So again, you may not be responsible for taking samples from the specimens, which is called aliquoting, all right? But at least you have to be familiar with what happens after you bring the specimen, okay? It is centrifuged. Remember that plasma specimens, that means specimens that are on anticoagulant tubes, like your light blue and your heparins and EDTAs and all, those all can be centrifuged right away. The ones that cannot be centrifuged right away are your serum specimens, the ones that clot, okay? Those are your gray tops, your RSTs, your orange, your non-additives, all those they have to wait for at least an hour, except for the orange one. That one will clot in 5 minutes. So again, you know what centrifugation is, how do you place the tubes in the machine, okay, maintenance of the machine. You just have to know that it has to be maintained. You have to make sure that it's working fine, and you have to record it somewhere, okay? What does it mean to aliquot a specimen? What is the technique is needed? Pretty much just discussed it, okay? It means taking serum or plasma from the specimen and putting it into the machines. Wherever the test is gonna be running, the machines need some of that serum or plasma to be put in there. All right. Handling processing specimens. This is probably one of the more important items that you need to be familiar with. How do you handle the specimen after you contained it? Okay, and there is a table on page. Let me give you the page number. We just covered it last week. Okay, on page 389. Page 389 tells you how you handle specimens. For example, some specimens have to be kept at body temperature. Some specimens have to be protected from light, and some specimens have to be processed immediately, okay? So you have to be familiar with them. And on page 389, the most common test that you're gonna see, right? Some of them that need to be kept at body temperature, which is 37 degrees Celsius, are your cold agglutinins. Please write it down, memorize it. Cold agglutinins have to be kept at body temperature. Cryofibrinogen or cryoglobulins. If you notice the prefix cryo, C-R-Y-O, it means cold, okay? In this case, cold needs to be kept warm. So remember that. But the most common one that you'll find is probably cold agglutinins. They have to be kept at body temperature. Other specimens that have to be handled correctly are your those that you have to put in ice slurry. You can remember ice slurry is crushed ice. It's not ice cubes. It's not water, ice water. It's crushed ice. These specimens require chilling because you want to maintain, right, the elements that are in your blood specimen, such as your capillary blood gases, your arterial blood gases have to be put in ice. Also, your ammonia levels. Ammonia is a very common test that is done. Make sure you put it in ice after you collect it. Lactic acid is also another very common test that is done. Remember, lactic acid is to measure the pH, right? It usually more so to measure the seriousness of the infection. So doctors will order a lactic acid level. It has to be placed in ice slurry. So blood gases, ammonia, and lactic acid are three of the most common tests that have to be placed in ice. Please remember that. And lastly, some specimens that have to be protected from light. The most common one you're going to see is your vitamins, okay, or bilirubin. Bilirubin. Remember, bilirubin is a result of breakdown of red blood cells. And when somebody has too much bilirubin in the bloodstream, they become yellow. Their skin becomes very tinged yellow, and the whites of the eyes become very yellow, okay, because of breakdown of red blood cells. Bilirubin can be harmful to the brain in excess amounts, so it's really important that you monitor. So if you don't have an amber tube to collect a bilirubin, then you can always wrap it with foil. So bilirubin has to be protected from light. Same thing for your vitamins, vitamin B, vitamin B6, B12, and so on. All those have to be protected from light. So it's important that you handle the specimens correctly after you collect them, all right? What type of containers, temperature requirements are needed to handle, store, and transport? Again, there's warming blocks, okay? There's bags with ice, or there's prefabricated warmers, such as the ones that you use to warm the sites. You also have prefabricated cooling devices. They make sure you just follow the right handling process for each tube. Chain of custody. I think we talked about chain of custody before. And when do you need a chain of custody? What is a chain of custody? A chain of custody is a document that has to accompany certain collections. A chain of custody is a document that has to be filled out for paternity testing. It can be required for employment. It can be required for drug testing, or some kind of a criminal samples, like in the cases of rape, things like that. Again, you have to make sure that the form is filled out correctly. And you can find the chain of custody sample on chapter 11. I'll give you the page number in a minute. Got the page number. But again, it's your job to make sure that all the information on that form is complete. What it is that you're going to fill out your information. The donor of the specimen has to sign. You have to verify their identification. And then you're going to handle that specimen to somebody else. That other person also has to make sure they fill out their information. You have to verify it with an ID and so on. So there's always a paper trail, right? A trail of who handled the specimen. Because if this specimen goes to court or is used for legal purposes, and that form is not filled out correctly, then the specimens will not be valid or used in the court of law. So it's very important that you fill out this chain of custody. What must you do to adhere to chain of custody guidelines for forensic studies, blood alcohol contents, and drug screens? Again, you must make sure that you completely fill out this form, okay? All right. that you adhere to all the policies of facilities as it relates to the chain of custody form. Okay, make sure that all the documents, all the signatures are there, that everything is verified. Otherwise, again, these specimens will not be valid. Communication with other healthcare personnel is one of the Joint Commission National Patient Safety Goals. When we communicate with other healthcare team members, it just helps and prevents a lot of problems. So when you coordinate with other people that are not from the lab, such as nurses and doctors, whether it be a timed test, if you're going to be collecting a specimen that's timed, make sure that you, again, communicate, call them and ask them at what time you need to be there to collect. That way you don't delay treatment and you collect your specimen correctly. If there's any problems or issues with a patient refusing to give up a sample, then you must also, again, communicate with the physician, with the prescriber of the lab. Make sure that you notify them that the patient is refusing. Remember that it's not your job to convince anybody to give you a specimen. Your job is only to collect it, okay? And anything beyond that is in the physician's hands or the nurses, whoever's the primary caregiver for the patient. What are internal and external databases? Well, internal databases are just a bunch of information on patients that are used in the lab. We talked a little bit about this in chapter 12. There's, the lab has a big computer with all the patient's information and is connected to all the computers that are in other departments, in other units, but everybody has access to that information, okay? Some labs also give access to external facilities. We can look in there and get results and print them out and so on. So that's all it is, what are internal and external databases. How do you retrieve specimen data using available lab information systems? You are given a login access, you are given a password, you're only given information that pertains to your job. Okay, you do not have access to the entire patient record, only what whatever it is within your scope of practice. Okay, again, it's your responsibility to make sure that you keep the privacy, protect the privacy of the patient. So if anybody asks you about a person's lab values or so on, and you're not allowed to share that with them. Remember what critical values or panic values are. These are values that are beyond, above, or below the normal ranges for the lab that you're looking at. So your job is to make sure that you report these immediately to the prescribing physician or the primary caregiver. I know laboratories are always calling me to report, critical values, to me, and then I have that problem, then I have to report it to the doctor. Some labs actually take it upon themselves to call the doctors and notify them. And remember that when you notify somebody of a critical value, panic value, you also have to document the name of the person you're speaking to, the time, date, okay, and the result, and that they read back to you. If you call me and you give me results, I have to read it back to you so that you verify that I understood correctly, that there's no miscommunication. So again, critical values or panic values are abnormal lab values that you have to report, okay? What do you do when you recognize a critical value, panic value for point of care testing? Remember, point of care testing is when you use a machine and you collect the specimen at the bedside or the patient's house. If you have a critical value or panic value, don't assume that the machine is right. What do? You're gonna have to do a quality control test on the machine. Make sure that the machine is accurate, okay? If it hasn't been done, a quality control that day, make sure you do that before you start using the machine. If you change batteries, if you drop it or whatever, a quality control has to be done every day. Now, if you repeat the test after the quality control has been done and it's still, at a panic value or above the ranges or below the ranges, then you have to make sure that you communicate and notify the physicians. They might ask you to collect a venous sample. If the point of care device is giving you, critical values, then they might require a venous puncture. What is the protocol to distribute laboratory results? The protocol, usually the physicians get the results right away. Again, it may or may not be within your scope of practice to relay results to anybody. So don't take it upon yourself to tell the patients, hey, well, your lab values are, critical. That's not in your scope of practice. So make sure that you follow the facilities policy on giving out information or results. What are the laboratory requirements as it relates to processing specimens? Well, laboratory requirements are, again, it's going to go down to the manufacturer's recommendations as far as the tubes, as far as how are you going to handle the specimen, how soon can it be processed, can it be refrigerated, can it be frozen, or does it have to be processed right away? These are all come down to the specific tube manufacturers. So that's not really a critical thing that you have to know for the exam. But let me see what else. I think that's pretty much it. On this section, handling process specimens. Again, the most important things that you have to know are the handling of the specimens. Okay, is it you know, they have to be in warm temperature or chilled or protected from light and so on. Look at that little table and make sure that you're familiar with it, because I can guarantee you that you're going to see it on the exam. All righty, let me see. I'm going to stop recording here.